You remember we have discussed receptor occupancy model. It's about to qualify the relationship between drug concentration and observed effect. But this model couldn't explain all receptor response. For example, when drug produces its multiple response, not all the receptors will occupy. About 95 to 99% receptor will not occupy. We call it spare receptor. So, there are some other model to supplement it. I will introduce you another model, a model of drug-receptor interaction. A model of drug-receptor interaction. The theory is the receptor is able to assume two conformations, Ri and Ra. Ri is inactive receptor, Ra is active receptor. If the drug binds to the Ri, they couldn't produce effect. If drug binds to Ra, they could produce observed effect. In the essence of the drug, the two isoforms are in equilibrium. 1. Full agonist drugs have much higher affinity for Ra conformation, so they could produce larger effect. 2. Partial agonists have an intermediate affinity for both Ri and Ra forms, so they could produce smaller effect. 3. Antagonists, according to the hypothesis, have equal affinity for both receptor forms, so they couldn't produce observed effect. 4. Inverse agonists, on the other hand, have a much higher affinity for the Ri form, reduce constitutive activity, and may produce contracting physiologic result. They could produce the response, but the response is inverse.